Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
So, first we will see non-proliferative diabetic retinopathy. So, in the diabetic retinopathy, the first type is non-proliferative diabetic retinopathy. Okay. In non-proliferative diabetic retinopathy, microaneurysms are present. These are actually the first detectable lesions of diabetic retinopathy, and these microaneurysms mainly occur in the inner nuclear layer. Then there can be intraretinal hemorrhages can occur. These intraretinal hemorrhages can be of two types. One, we have deep hemorrhages are called as dot blot hemorrhages can occur, or there can occur even the superficial hemorrhages can also occur, which are called as flame shaped hemorrhages can occur, which are superficial hemorrhages. So we have dot blot or deep hemorrhages or superficial, which are flame shaped hemorrhages are seen, and hard exudates can occur. These hard exudates are actually the deposition of lipids within the retina are seen, which are hard exudates. Similarly, there can be soft exudates will also occur. These soft exudates are actually cotton wool spots which occur because of the disturbance of axoplasmic flow. Whenever there is disturbance of axoplasmic flow occurs, leading to the accumulation of the waste substances which look like soft exudates or cotton wool spots. And finally, in the non-proliferative diabetic retinopathy, venous looping, beading of veins, and also sausage like segmentations are also seen in non-proliferative diabetic retinopathy. So along with these, we will also see presence of intraretinal microvascular aneurysms abnormalities, and there is also AV shunts are also seen due to capillary closure. So in non-proliferative diabetic retinopathy will look like this. Okay. So these are the dot blot hemorrhages. So this is also a dot blot hemorrhages with, this is hard exudates which are lipid deposition, and these are cotton wool cotton wool softs or soft exudates are seen. And microaneurysms, if you see, you can see it in this picture. So here many blots which are seen, these dots are actually microaneurysms when here. So these are microaneurysms are seen in this picture. Okay, so this is non-proliferative diabetic retinopathy.
thank you and thank you for watching.